In today's video, I will be discussing my reasoning for suing the New South Wales Government and the New South Wales Health Department. G'day, it's Charles Mackenzie from Infected Blood Australia, and in recent days I've been sharing videos about the amount of dental problems people like myself, victims of Australia's deadliest medical scandal, contaminated blood, have in trying to get dental care. Now, if anyone that knows anything about medicine knows that if someone's got HIV or a deadly virus like Hep C, our teeth can literally fall apart and they implode. Okay, so I've got a lot of shattered teeth throughout my mouth, and for many victims in our group, this is how it is, right? And so it's not the easiest thing in the world to go and see a dentist when you've got something like HIV or Hep C, and it wasn't very easy, I can tell you, in the 1980s or the 1990s. Anyone in our group will tell you that was a pretty tough time, and we've got victims in our group that were literally asked to leave dental surgeries after the dentists had a panic about their infected status. And it's been very uncomfortable. So a lot of tainted blood victims really don't like going to the dentist, and this is why almost 20 years ago now I forced a Senate inquiry into the hepatitis C contamination of Australia's blood supply, and that Senate committee unanimously agreed. It had Labor senators, it had Liberal, it had left-wing Green people, I think. It had the whole horrible smorgasbord of Australia's politicians. And they, as disgusting as Australian politicians are and as corrupt as they are, they could see that, if children infected with Hep C or HIV, or mothers infected with viruses from contaminated blood given during childbirth, or people that were wrongly given blood when they shouldn't have been given blood and it turned out to be contaminated, or people that were knowingly given contaminated blood. Yes, that did happen. Authorities knew that in many cases blood transfusions or blood products were contaminated and just injected them into patients anyway, okay? So those senators knew that. And they knew that this thing was an absolute calamity. It's Australia's worst treatment scandal. It's Australia's worst medical scandal. And so they said, look, people who've got viruses from blood transfusion or blood treatments need to have dental care. And so they unanimously decided 18 years ago that Australians caught up in our deadliest medical scandal should have their teeth looked after. So you can imagine how I feel all these years later, and how victims in our group feel all these years later, when the government reneged on that. So New South Wales Health, they said no. Okay, they're not going to provide dental cover to tainted blood victims. Okay, so we get no dental care at all. And many victims in our group before COVID had to fly overseas because it was cheaper to get their teeth fixed overseas. So I let New South Wales Health know some time ago that I would sue them. I said straight out, I'm going to sue you. If you don't help me fix my teeth, I've got an abscess. If you don't, we're going to go to court. Okay, because I pay taxes and this is a dental emergency. You're going to do the right thing. I care about the healthcare system. I care about my health. And I'm not up for these people who take our taxes and do the wrong thing by people in New South Wales or people in Australia. And so, New South Wales Health said, okay, we will get you a dentist. And they did. And so they got me a dentist who was a very nice fellow, I have to say, no complaints, very polite, and I was very impressed with him. His name was Dr. Ahmed. And I told Dr. Ahmed I have a bleeding disorder. I showed him my latest blood results and said that I was very uncomfortable with a private dentist doing it in case I had a major bleed. I wanted it done close to a hospital. I wanted my tooth extracted. And he said to me, oh no, don't get it extracted. This is not too bad. We could actually do a root canal treatment and we could save the tooth. And I was pretty reluctant because I didn't want to be mucked around any further. I've spent 2 years trying to get them to deal with my teeth. And I said, I don't know about that. And he said, no. He assured me, Dr. Ahmed assured me it could be done in a timely fashion. And seeing as he was a nice guy, I liked him. I like doctors and nurses in Australia. They're very professional, very good by and large. And so I said, okay, let's go ahead, because I trusted Dr. Ahmed. And he said, great. And this is a couple of weeks ago. He said, great, I'll ring you on the Monday and I'll let you know what we're going to do, when we're going to get started. So the Monday came around and I never heard from Dr. Ahmed. Instead, I got called up by this lady from Sydney Dental Hospital, And she said, oh, you're to come in tomorrow for root canal. And I said, that's less than 24 hours notice. I mean, I'm very keen to have my tooth addressed, but I'm disabled. I can't get there with such short notice. And she said, did Dr. Ahmed tell you how it works here? And I said, no, he didn't. He said he was going to call me back and never heard from him. And she said, well, how it works is we have students here, so there's only a very few slots for them to train on your tooth. And so, you've really, when we give you a slot, you've got to take it, basically. And so she said, I'll see if we can get you another one. And so they, a week went by and they said, we've got another appointment for you. So I then went in to the Sydney Dental Hospital to go to this other appointment. And I put my mask on and they make you QR code. Okay? And then you enter your details and it asks you questions via the QR code like, have you been overseas? And have you had a COVID symptoms lately? And have you been vaccinated? And how many times have you been vaccinated? And so on and so forth. So I filled all of this out, okay? And it came up like this. Okay, now that what they do at these Sydney Dental Hospital and at health facilities in New South Wales, they have these door people. And they're not nurses, they're not doctors. I don't know what they are. I think they're staff from New South Wales Health, security guards from a firm that the hospital has hired. I don't know. But they're devoid of the milk of kindness and they don't know how to speak to patients either. So I show this and this very, very rough woman called Janet straight away says, your mask is down too low. Put your mask up. Okay, now it's not the first time this happened to me at this place. They have an obsession with my mask. My mask was up here, was covering my nose, covering my mouth. Now, this is another thing that's going to come up when I sue New South Wales Health. There's no way that I won't be. I'm definitely doing this. Yeah, I've had enough. I really am. There's no way. We're going to have to do this. And if the judge says it's okay, then I'll bow my head and I'll leave the country immediately. I will leave Australia. Because this country is no longer my country when it does these things, okay? So in order for me to stay here, I have to not have crimes committed against me. That's the way it works, okay? If you commit crimes against me, I'm going to take you to court, and if your court decides that the crime is okay, I'll leave your country. How about that? So they basically get me in there. I'm accosted about my mask being too low, and then she said, why are you unvaccinated? To which is very rare, I lost my cool. And I said to this Janet, get out of my way. I've got an appointment. I've got root canal therapy upstairs and I want you out of my way. Okay, I don't have COVID. I submitted to a rat test, as I've done every time I've gone into these facilities. It was clear. I agree to wearing a mask despite having a breathing disorder that's caused by the cryoglobulinemia, okay, that came about as a direct consequence of my infections from tainted blood. And by the way, the New South Wales, the Australian Red Cross and New South Wales Health Department in the 1980s collected blood from a prison convict, a former drug addict, who they knew to have hepatitis C, and they gave it to me and they gave it to many other patients. And today, New South Wales Health, they still send me bills for my pathology. Here is a bill for $60. It doesn't seem like a lot of money, does it? But imagine getting these all the time. This is a blood test for the cryoglobulinemia. I don't even know how to pronounce it. It's an autoimmune condition that stops my blood from flowing correctly, and I've lost control of my bladder, okay? So I'm going to have an operation to put a catheter in, okay? I'm losing function of parts of my body, and I will have to pay another $60 bill to New South Wales Health for yet another confirmation that I've got this autoimmune condition that came about because of my tainted blood. So I then went upstairs and I had the first stage of my root canal treatment, and I arrived and a student dentist there told me, just as they went through the protocols for the hospital to inform me as a patient, she said, now, if you're late or if you do a no-show to any of the appointments, what the Sydney Dental Hospital will do is you'll be put on the waiting list and on the back of the queue. Do you understand? And I said, yeah, I understand. But the thing that gets me is that we were promised dental care, money for private dental care 18 years ago, and I'm getting a lecture. Now, I don't take drugs, I don't drink, I'm a law-abiding citizen, And I'm getting lectures about if I turn up late or if I do a no-show. Why would I turn up late? Is that because I've got Hep C or something from tainted blood, or I do a no-show? Why would that be? Why would I do a no-show? So why are they treating me like that? Like, does a private dentist normally speak to his patient like that? So anyway, that's what the young dentist told me. And then she started drilling. And then she doesn't know what she's doing. She wasn't the sharpest tool in the shed. And she's calling over to supervisor. What do I do this? Have I got the third canal? Oh, there it is there. This is literally what happened. I hope they have a recording of what happened. It'll come up in court. Oh, is that the canal there? Oh, there it is. Oh, it's quite wide, isn't it? And of course, I've got a bleeding disorder. I'm lying on the dental chair just thinking, bloody hell, we were promised private dental cover. And I've got a student 18 years later doing exploratory drilling. Anyway, she said, right, well, after 3 hours of her drilling, she said that, well, we've now done stage 1. And she said, now we'll need to do more work on your tooth, and you're to come back on next week, on Thursday, the 26th of May. Well, anyway, as I was leaving the facility, the Sydney Dental Hospital, I came across. As I was leaving the building, I did a short video of myself talking, and I was talking about how I'd been accosted and asked about my vaccine status, even though I'd done a RAT test, and even though I'd done I'd worn a mask and all the other baloney. And I had my privacy breached, and I was just talking about that, and guess what? One of the staff has a go at me. Leaving the Sydney Dental Hospital, you can see over here they have this check-in area here. I had a moronic staff member here. The dentist and the nurse is very good. The staff member here today accosted me and asked me why it was I'd marked down that I wasn't jabbed. I think someone's complaining. What was that, sorry? I didn't video you. It's okay, I didn't video you. I beg your pardon? I can't hear you. Gosh, you're so mean, aren't you? Come on outside, come on. And do you know what? You actually spoke to me about my vaccine status today. Yes, it was. It was Janet. No, it wasn't. It was Janet. There she goes. And then she gets security guards, and they all surrounded me. I've just had root canal therapy. I've got a bleeding disorder. It's not, I was worried about having a bleed and all of this. Do they care about people's, mental health and their well-being? Not that I'm mentally ill or anything like that, although they'll probably make out I am because I objected to being asked about my vaccine status, so they consider that crazy to know. I don't want to be vaccinated. Why don't I? Well, I've heard reports that they're not going down too well, and I take lots of vitamins, and if I die, I die. But I just don't want the jab, if that's okay. I'm not an anti-vaxxer, but, to them I would be, of course. So anyway, that was how I was treated. And it just, why I find it interesting is if you have a look at the Sydney Dental's videos about how they treat patients, this is what you'll find.
I'm a concierge of Sydney Dental Hospital. When the patient comes in, I greet them. It's nice to see a friendly face when you walk through the door, especially if you're nervous or you're lost, not sure where to go. And there's a friendly face to come and help you.
Yeah, right.
Lead you in the right direction. I think it's a great idea.
Lead you in the right direction to security guards surrounding you.
Now that I'm working as concierge,
honestly, this video was done just before the supposed pandemic of 2020 started, right? Wow, what happened to her, eh? Sydney Dental Hospital, what happened? What happened to you? And what happened to the New South Wales Health Service, eh? You ended up discriminating against victims of Australia's deadliest medical scandal, contaminated blood. The way you've treated me, do you know, you've booked me in for dental appointments, and then I'm disabled. I turn up to a dental appointment at 8 a.m. in the morning, and the dentist doesn't even turn up, and you didn't even tell me. 2 years of this, and look at this tooth. Still infected, you idiots. You've done all of this in my mouth, and now you've cancelled. You've cancelled another appointment because I complained about you breaching my privacy. See you in court, New South Wales Health. This is the reason why I'm suing. I've had enough, as has our group. We've been abused, we've had enough, and I'll see you in court. You're never going to come near my teeth again.